Back on the Chamber Report, our member profiles, and the ship has returned to the harbor. Cole Hanson is with us. He's with Anoka County SHIP. Cole, how you doing, man?
I'm doing great. It's nice to be back.
That's great. All right, so it's been a little while since you've been here. In fact, about 6 months since we last talked about Anoka County SHIP, but there's folks out there that are watching for the first time, maybe not know what Anoka County SHIP is. Why don't you give everybody a refresher?
Yeah, so just a little bit of background. So Anoka County SHIP is a state-funded program, but it is implemented by the Anoka County Public Health and Environmental Services Department. And we prioritize a couple of different strategies, so that's healthy eating, physical activity, mental health and well-being, lactation support, and tobacco cessation across the community in lots of places, ways, settings, you name it. We're here to help the community kind of get over those boundaries and make those changes.
And you're working with business people and helping some of those things happen. I've heard about some great stories, which I'm sure we'll hear about in a little bit. But one of the things I want to kind of center in on, you talked about mental health. Boy, it's something we hear a lot about lately. What's going on with SHIP and with mental health?
Yeah, so it's kind of an interesting time. So statewide, we've been reflecting on kind of our strategy towards mental health and well-being, and it's gone from something that we've considered to now it's a priority statewide. So while we don't do any real counseling or anything, and we're not delivering one-on-one services like some professional organizations do, we're at the health department, so we're working on providing resources, tools, and access to the entire community, whether it's task forces or with toolkits, or in my case, I work directly with workplaces and businesses, nonprofits, for-profits, wish-for-profits, to help them kind of consider mental health and well-being as a part of their everyday life in the office or on the line.
It's great to hear that it's not just a one offering, that you adjust and deal with multiple levels of how to deal with it. And let's face it, on a mental health level, you need to have multiple ways to attack. Now, you also talked about working with businesses and nonprofits. Let's talk about the nonprofit side of this thing. What are you doing with them?
So a lot of the work we do, it's honestly with nonprofits and for-profits, it kind of aligns.
Yeah.
We're doing a lot to really create the opportunities for conversations to happen inside the workplace. A lot of people, you want to bring your whole self to work, right? That's how you're going to do your best work. That's how you're going to make the difference that you want to, especially in a nonprofit. But you can't do that if your whole self isn't able to be there, right? You're distracted by stresses at home. Maybe you've got a sick loved one. Maybe you're sick yourself, or maybe you've got some other really complicated thing that you don't want to talk to your boss about. That's fair, and there's lots of conversations like that are hard to have. But you should still feel okay in the workplace to bring your whole self. And
absolutely. Absolutely, it's going to affect the work. Trust me, the people there, number one, I would hope care for you. And number two, the better you are, the better job you can do for them. But it does come to the fact that there's a care part. Hey, I'm glad that you came up with something like this, because getting started on addressing something outside of your expertise is one of the scariest things and parts about being a leader.
Yeah, and that's one of the things. So we recognize that a lot of businesses and organizations are at different places in kind of addressing mental health and well-being. So to kind of meet everybody where they might be, we'd actually developed a really great toolkit called Finding Calm at Work. And this is a really great project put together by one of our interns through the University of Minnesota School of Public Health and some of our professional staff on creating a toolkit that anybody from first week, first job office assistant, all the way to a tenured, multi-decade, career-long HR professional would feel comfortable saying, hey, I could pick this up, I could run with something like this, because we have everything, besides a brief introduction, we want to give you a calendar of things to do. We come up with a full kit that includes not only just evidence-based resources, things that are tested in the community, right? We know they work, but also they're based in evidence that we have the university working on or other organizations. But also, it's on a schedule, it's on a timeline. You don't need to overthink it, and it's going to be able to propel you into those next steps.
So how does somebody get started on the campaign? What happens?
So it's pretty straightforward. You can get in touch with us at the health department. Email is ship@co.anoka.mn.us. It's a mouthful, but Go Anoka County is the website. It's easy to find us there. But it's as easy as picking up the toolkit, giving it a read through, and there's lots of resources. In fact, what makes it really handy is there's a lot of stuff that's made for your employees to see that you don't necessarily need to create off the top. Newsletter pieces, handouts, posters, project guides, those sorts of things, it's already done. So there's no reinventing the wheel here. It's just spinning the wheel and getting going.
All right, so somebody gets that, and it's so great to be able to have that. Trust me, business people, because no one's got time. That's why SHIP is here to help get you through this process. And as you start through it, once you get to the end, Cole, then what happens? I mean, are they just floating out in the middle of the ocean by themselves, or what happens next?
Yeah, and that's the real challenge, right? Is because you want to pick this up with the idea that this is going to help propel you into something new and doing your business in a different way than before, right? You want to make that long-lasting change for your organization and for your employees and for yourself. And so part of this structure is that we're kind of readying the catapult to kind of launch you forward with our Make It Okay campaign, which is a partnership between Anoka County Public Health and a variety of other agencies and organizations across the county, and it's part of a larger campaign statewide as well, to make mental health awareness and feeling a little less than okay at the workplace be okay. Sure. And there's a whole set of resources and tools through that campaign that once you finish this, you are ready to just kind of pluck from the tree and go right into.
So we got somebody out there that's interested. How do they take that next step to start this process?
So again, that comes down to just getting in touch with us. We have the toolkit available. Also, you can also reach out to your local chamber representative as well, because we work closely, especially me on behalf of our worksite program, with all the area chambers and all the different organizations that support employers across the region, whether it's the Job Training Center, even your local library. We have resources floating around there. So we're really trying to be where local people are, no matter whether they own the business or work somewhere.
And for the viewers that are watching on QCTV, you got a piece coming up here, a little bit more expanded.
Yeah, it's very exciting. So through a nice opportunity with QCTV, we're doing kind of a workplace wellness roundtable with some of our partners that we've had across the community to showcase the successes they've had and talk about kind of the ins and outs of kind of doing workplace wellness and making well-being changes from an employer's perspective and from a business owner's perspective based right here in Anoka County.
That's great. And you can go to qctv.org and find the schedules of when that thing's going to be. Cole Hanson, Anoka County SHIP, good stuff. It's just all good stuff. It's good stuff for business. It's good stuff for those nonprofits. And it's good stuff for the people that need some of that help as well. Cole, pop back sometime, give us an update on how things are going.
Absolutely. I'm looking forward to it.
That's great. All right, we're taking a break. When we come back, Profiles continues right here in the Chamber Report.